A gastric bypass is a type of surgery that's been around since 1950s and 1960s. If you go back 5 years ago, it would have been the most common operation performed around the world, mainly because so many were performed in the United States. The added bonus to a gastric bypass is that it's probably a little bit better at getting people to manage their diabetes. So in this country, it's usually used as a first-line defence in someone who has got very severe diabetes. The majority of people who are getting gastric bypasses in this country right now are those patients who have had previous surgery before. So that's revisional surgery, second-time surgery or third-time surgery. As some surgeons think, me included, that it is a little bit safer to perform than a sleeve gastrectomy under those circumstances. It is an operation that requires us to cut a small portion off the top of the stomach and disconnect it totally from the rest of the stomach, and then rejoin that, what we call a pouch, back to some small intestine. So the food would then travel down your esophagus, through your gastric pouch and straight into your small intestine, and as such bypass your stomach altogether. It is a little bit more complicated than that of a sleeve gastrectomy. It requires a little bit longer in the operating theatre. It has a slightly higher complication profile in the short term. Most people will stay in hospital again, 2 or 3 nights in hospital. There are some short-term complications like gastrointestinal leaks, as you do get with a sleeve gastrectomy, but they're a little bit higher risk, perhaps 1 to 2%. Bleeding can be an issue again in probably about 1% of patients. In the long term, you don't get symptoms of reflux like you can with a gastric sleeve, but you do bring with it a small risk of a small bowel obstruction year on, year out for the rest of your life, which you don't get with a gastric sleeve. The benefits to it in regards to weight loss are very similar to that of a sleeve gastrectomy. So with the surgery, you can expect to lose 70% of your excess weight, which is very similar to that of a gastric sleeve.